I'm Dr. Eric Andruski, pediatric gastroenterologist with Riley Children's Health. I'm here today to talk to you about constipation in children. Constipation means hard poop that may happen a few times a week or less. Constipation is very common in kids. Some estimates show that up to 1 out of about every 3 kids will struggle with it. While there are no easy fixes, constipation can usually be managed by your pediatrician. If children are constipated for a long time, they may develop encopresis, or leak liquid stool instead of having large, hard bowel movements. Sometimes this can be confused with diarrhea. Other children may feel like they can't get all their poop out. Pooping may also be painful or require a lot of straining. In kids, it may be from holding their stools in due to prior experiences of fear or pain, and is especially common during potty training or when just starting school. Pediatricians are skilled at managing constipation. During your visit, they'll ask you a lot of questions about your child's poop, like how often they go, what it looks like, if it is painful, if there's blood, and if they ever have poop accidents or can't control when they poop. They may also ask questions about belly pain, vomiting, weight loss, and diet. Lastly, it's important to know when the difficulty pooping first started and if it's getting worse or staying the same. Most constipation does not need any special laboratory or imaging testing. There are some red flag symptoms that your pediatrician will be on the lookout for, like significant weight loss, your child not pooping within the first 24 to 48 hours of birth, muscle weakness, a change in the way your child walks, or lead exposure. They also may examine things like reflexes and look for changes in the skin of the lower back. If any of these are abnormal, your child may need blood or imaging tests. Otherwise, your pediatrician may recommend medicines to help keep your stool soft, help your colon contract, or both. There are many choices of medicines to treat constipation. Some common ones include Miralax, milk of magnesia, and Senna or X-Lax. These medicines are not habit-forming, and your child will not become dependent on them. It's important to continue these medications unless your doctor instructs you to stop them, as constipation can reoccur quickly if not treated for a long enough duration. It's not uncommon to need treatment for multiple months or longer. Long-term constipation most often needs medicine to help treat it, but there are other things you can do at home. Toileting routines can be beneficial. Kids should try to sit on the toilet for 5 to 10 minutes after meals twice a day. After eating, your body sends a signal to your colon to push poop out and make room for what was just eaten. Other things that can help are having a footstool and avoiding distractions like a phone or tablet. Finally, some kids may benefit from blowing bubbles or into a pinwheel. This can help the bottom relax to let poop out. Pediatricians are great at managing constipation, but sometimes difficult to treat constipation needs management by a GI specialist. If you haven't noticed improvement for your child after taking medicines consistently for several months, your pediatrician may refer your child to a gastroenterologist. Other reasons you may be referred include constipation with weight loss, concern for an anatomic or structural cause of constipation, or constipation so severe it requires admission to the hospital. At Riley Children's Health, we're here to support you and your child. Your primary care provider can submit a referral when appropriate to our team. Or you can also search for a Riley physician or location that meets your needs at rileychildrens.org. Constipation can cause small tears in the skin around the bottom, called fissures, that may cause a small amount of bright red blood in the stool. If your child has more than a few drops of blood in their stool, black or tarry stools, severe abdominal pain, or is unable to drink enough fluids to stay hydrated, you should seek care in the emergency room. Questions your pediatrician may ask. How often do they go? What does it look like? Is it painful? Is there blood? Do they have poop accidents? Are they unable to control when they poop? Red flag symptoms. Significant weight loss. Not pooping within the first 24 to 48 hours of birth. Muscle weakness. A change in the way your child walks. Lead exposure. Thank you for listening today. If you have any questions or concerns, please contact your pediatrician, and we are happy to partner together to help with your child's care.